Hey guys, what's going on? Welcome back to Second Opinion. I'm Virgil, and of course, this is Dr. Haggard. Also, if you haven't liked, shared, subscribed on our Facebook or YouTube, you better do that.
All right, so today we're going to talk about growth hormone, Sermorelin, and Ibutamoren. What do you know about these topics?
Well, my husband knows about one of them, and then I know about the other. And yes, it gives you erectile dysfunction. Had to say that. I'm sorry, because that was embarrassing.
So, in looking at people that have low growth hormone or growth hormone deficiency, when you first study these people, they have reduced bone mineral density, they have a decreased exercise tolerance, performance, less muscle strength, thinner skin, more wrinkles, reduced immune function, and just overall lower quality of life. So when looking at these people, they started to say, well, what if you gave somebody growth hormone? And could you reverse some of these things that are just typical as we age?
Yeah.
Right? I mean, as we age, these are the things that we see. And that's exactly what you see is if you can increase someone's growth hormone levels at their middle age or older, we can see increased lean body mass, decreased fat mass, increased exercise tolerance, increased maximum oxygen uptake even, and increased muscle strength. So the main thing that anytime I mention growth hormone or I hear a lot of other doctors talk about it is if you increase your growth hormone, are you going to increase your cancer risk? Either developing cancer or if you already had a cancer, is it going to make it develop and grow? So when you look at the long-term safety data, it's very limited with these category of medications. However, there are people who have elevated growth hormone levels. It's a rare condition, but it's known as acromegaly. So this is people like Andre the Giant, right? So he grew to 7'4" and was almost 500 pounds.
That's insane.
Yeah, you recognize him, right?
Oh yeah, I know.
Yeah.
I grew up with WWF.
Yeah, so he was also in The Princess Bride, which I love that movie. And then, do you recognize Richard Kiel? He was the actor that played Jaws in James Bond. He had like the crazy metal teeth.
I do remember that one. He scared me when I was little.
So when you study people with acromegaly, which they have elevated growth hormone levels the majority of their life after puberty, right, as teenagers. And when you study them, there are some increased cancer risks, but they're very modest. And this is interesting because we see it with just a few select cancers, colorectal, thyroid, breast cancer, and prostate cancer. But in the case of prostate cancer, it's more the cells are just proliferating. They're just growing. They're bigger people. They just have bigger glands, and they continue to do that throughout their life because they usually continue to have elevated growth hormone levels, even unless they have some sort of intervention like surgery or something else like that. But if you're looking at that and saying, wow, people that have these super high, crazy levels of growth hormone, and they're only having possibly a modest increase in cancers, it kind of is a way for me to rest assured and say, well, when you do growth hormone therapy, you're not trying to achieve these levels. Nobody's trying to be Andre the Giant. So when you take it, if you're restoring growth hormone levels to like youthful levels, because typically after age, later 20s, 30s, every decade, your level of growth hormone tends to decline. So as you age, you tend to have more chances at benefit for doing some sort of growth hormone therapy.
So how often would you take this?
It depends. So the most common first start approach, I think that people think of is growth hormone directly. So you can get growth hormone directly. It's an injection. And I was a huge fan and proponent of this when I was in clinical practice. I prescribed a lot of it. I took it myself. I thought it was fantastic stuff. The only caveat is I realized there's a very common side effect, and that is like you get the swelling on the hands and the feet, like the tingling, paresthesias kind of stuff. Carpal tunnel. It's pretty common. It's like 30 to 50% of people.
That's the side effects for this stuff?
Yeah. Yeah. And so if you get that side effect on growth hormone, you typically discontinue the treatment. Usually have to wait a couple weeks, and then you can usually slowly start it at a much smaller of a dose and not have those effects. However, the issue is when you take growth hormone, it actually produces a super physiological spike of growth hormone. Because normally when you make it at night when you're sleeping, and it's this nice gradual curve over the entire night. But when you take it in an injection, all of a sudden you get this huge spike. And that's where you start to see all these side effects of like the fluid, edema, swelling, tingling, because you have this super physiological effect. And then the other thing too is when you take growth hormone directly, it actually increases your IGF-1 all the time. So IGF-1 is insulin-like growth factor. And that's where you start to say, wow, if this is always going rather than like this pulsatile secretion that your body does, but if it's just elevated all the time, well, theoretically, that would give you more of a risk of developing some sort of cancer. Also, when I was in practice and I had it, I don't know, a lot of people on it, and then I took it myself. But the other issue is it got real expensive.
Oh, yeah?
Like really expensive.
Really?
And insurance mostly doesn't cover it because this is kind of like an elected thing unless you have a true growth hormone deficiency, which is very difficult to meet that criteria. There's
Really?
a lot of things that you have to have wrong with you in order for an insurance company to pay for something like that. So then I started to get into Sermorelin, which Sermorelin is a hormone that you produce, growth hormone releasing hormone, so it mimics that. So it mimics growth hormone releasing hormone so that it stimulates your own natural production of growth hormone throughout the night. So you typically take it at night before you go to bed, 30 to 60 minutes before you go to bed, and it increases your own amount of growth hormone. So we see it increases IGF-1 modestly, growth hormone, that natural kind of pulsatile thing. And so because it's doing that, it's stimulating your own production, then you have this feedback loop that prevents you from having your growth hormone way too high, like as in, you were having a pituitary tumor or something. So there's a ceiling to it. And it's considered one of the safest growth hormone optimizing therapies because it doesn't force that super physiological IGF-1. And it encourages more natural growth hormone patterns rather than just this chronic elevation. So Sermorelin, like growth hormone, may improve sleep onset and quality because your body's healing. So that's usually when you get that really nice deep sleep. It also increases mildly in most people lean muscle. It will also reduce fat mildly and gives you better wound healing because it's growth hormone. That's what it's doing. It's getting everything to recover if you have either injury or exercise. It actually makes your skin thicker and makes it have better elasticity. So I think Sermorelin is fantastic to do following rapid weight loss or a large amount of weight loss after like all these other medications that are so popular today with all the GLP-1s. So I think Sermorelin is fantastic to follow those medications with because of the skin tightening, the lean body mass, because you get that sunken face.
Yeah.
A lot of people complain about that with the rapid weight loss. Helps improve your lean body mass.
Okay.
And your skin. So that helps.
That's awesome.
Now, the other interesting thing is you tend to get better results if you don't eat 2 to 3 hours before you go to bed if you're taking this. Because if you eat specifically carbohydrates and proteins before bed, that stimulates your insulin production, which counters your growth hormone secretion.
All right.
So that's one thing that I think a lot of people don't know about. But going in directly, I just did a recent search and I haven't been able to find any current evidence that shows Sermorelin increases cancer risk, specifically in older adults. And there's no clinical trials I could find showing increased cancer incidence or even recurrence if someone had cancer previously while taking Sermorelin.
All right.
So overall, I think it's one of the safer ones.
Okay.
Now, besides taking the growth hormone directly or doing the injection of the Sermorelin, which typically, it's a sub-Q injection. Most commonly, you do it like in the stomach, hip, or the back of the arm. We have an oral option as well, and that's Ibutamoren. So you know a little bit about this.
Yes, I do. That's what my hubby is taking.
And what was his results?
he is hungry. He is starving and he wants to bulk up. So it's working.
Yeah. And
he has gotten bigger, huh?
He's gotten bigger.
Yeah, it's crazy. And it was like really quick too.
So it's funny that you went straight to that. It makes he's hungry, right?
Yeah.
So all three medications are growth hormone increasing therapies. Growth hormone directly. Sermorelin does it indirectly through your pituitary, but Ibutamoren does it through ghrelin. So you have the ghrelin itself stimulates your appetite, and that's how it works. And that's why it has different effects compared to Sermorelin, is because it's acting on your appetite hormones directly.
Well, I've definitely seen it. It's quite expensive. I'm just kidding.
So because it's acting on ghrelin, it forcefully stimulates your IGF-1 and your growth hormone secretion. So because that forceful stimulation, Ibutamoren doesn't have that preserved normal feedback loop. So there's no feedback protection. So when it comes to cancer risks, if we are focused on the IGF-1, then Ibutamoren would have a little more cancer risk. And then the other name for Ibutamoren I meant to mention is MK-677. So if you kind of put this all together, you have the similar effects of the Sermorelin with the Ibutamoren and the growth hormone. And when you take it, because it acts on your appetite, and I didn't know this until I was doing the research on for this episode, taking it at night can increase your nighttime hunger. You can also be restless, get vivid dreams, because it has this cortisol-related sleep disruption that can happen with it. So I didn't even know that was an issue. So if you are going to take Ibutamoren, you'd want to take it in the morning or early afternoon.
Okay.
So growth hormone you take at night, Sermorelin you take at night right before bed, and again, you're trying to avoid food with those ones a little bit.
Yeah.
Right when you take it before bed. And then Ibutamoren, because it works on food, you don't have that issue.
Yeah.
So you take it in the morning.
So what happens if you end up taking it during the day?
Taking which during when?
Sermorelin.
If you take it during the day, it doesn't have as much of an effect for increasing your growth hormone production at night.
Okay.
Because
that's when you're
because
I've been doing that for a little bit. I didn't realize you're supposed to take it at nighttime. So now I'm going to start. Yep. It's the story of my life, right?
Like an executive overview, the growth hormone injections have the strongest effects, but the highest risks.
Okay.
As far as when it comes to cancer and actually other side effects. The Sermorelin injections have some physiological effects with the lowest risk, and then somewhere in the middle is the Ibutamoren, and that's the oral capsules typically is how I see it. And that has strong effects. It's stronger effect than Sermorelin, but it does also have moderate risks. So that's the overview of putting all three together. I personally favor the Sermorelin. I've tried all of them.
Yeah.
And I've had the paresthesia effects, like the carpal tunnel. I got it in both my hands and my feet, and it was horrible. It was really bad.
And then when you got off of it after 3 weeks, it got better?
Yeah, it took about a couple weeks to go away, but then I came back on it and I was able to titrate the dose. But I've never had that effect with Sermorelin. I've never even heard of anybody having the effect with Sermorelin. So It says it's a potential in the research. I just don't see it. It's really safe. It's also dose dependent as well. So again, I think with anything, if you start with a low dose and build up to it, that also offsets your risk profile for developing any problems. I hope you guys enjoyed the episode today. Please like, follow, subscribe. It helps our channel. If you have any suggestions for further topics, please leave them in the comments, and we'll see you next time.
Bye.
Follow my podcast on drjessehaggard.com.